So hi guys, today we're going to talk about a very simple topic called pneumoconiosis, and in this we're going to talk about three common dust particles which we have in our which we are exposed commonly. The most common of all pollution is carbon. So remember, carbon is completely digested by the macrophages, and these carbon-laden macrophages usually accumulate in the lung. And they usually, when they just carbon-laden macrophages accumulate in the lung, this is called macules. Slowly they can develop into nodules when they start developing fibrosis along with this carbon-laden macrophages. So remember, this is called cold worker pneumoconiosis, in which it deposits as macules and nodules. Okay, and this cold worker pneumoconiosis typically involves upper part of the lung more. Okay, remember that point always. Okay, rarely in 1 to 2% of the cases it can undergo massive fibrosis, and the nodules can become more than 1 centimeter in size, and that is what is called as progressive massive fibrosis. Now coming to the second dust again, which involves upper part of the lung more, it is silica. So silica is dangerous of all because these are crystals and they damage the macrophages. As soon as the macrophages come to eat silica, this silica particle destroy the macrophages and it releases a lot of fibrogenic cytokines, and it causes progressive massive fibrosis. Again, more than 1 centimeter fibrosis typically in the upper part of the lung, and this silica can also go to the hilar lymph nodes and cause eggshell. It can be seen as eggshell calcification there. So always remember guys, silica and carbon both involve upper part of the lung, and carbon usually shows you macules and nodules and rarely progress to progressive massive fibrosis. Silica usually form collagenous nodule and commonly have progressive massive fibrosis. Now coming to the third dust, okay, which is one of the very favorite exam question which is asked. Okay, so this is asbestos. So asbestos, remember, is partially digested by the macrophages. So because it's partially digested, so the left out part will release cytokines and cause fibrosis. So it causes interstitial fibrosis, number one. Number second, it basically causes pleural plaques. So asbestos patients have pleural plaques, interstitial fibrosis. So this is common feature of asbestosis. Okay, apart from that, once a person is exposed to asbestos, a latent period of about 15 to 20 years is needed for him to develop mesothelioma later in the life. Also, you can see this asbestos particle as asbestos bodies in the lung, which is shown in the image here. Because it's partially digested by the macrophages, it can later deposit iron on its top, and then it is called as ferruginous body, which can be highlighted with the pearls brush in blue like this. So this is typical about asbestos. So remember, carbon and silica involve upper part of the lung more, asbestos involve lower part of the lung. Okay, and eggshell calcification is a feature of silicosis. Bye.